All right. Hey, everybody. We have an exciting episode for you for the New Frontier podcast today, and welcome to kind of the next rendition of where we think pharmacy is going. So, joining Jaron and I today, we have an incredible special guest, and Stephen Lee from Click Therapeutics. Met him a little while back and have been following a lot of the work that he's been doing. That I usually nerd out in that particular space, so you guys get to nerd out with Jaron and I. We never do any nerding out, Jaron, right? That's not part of our job.
Never.
Okay, good. So want to pass the baton over to Stephen to do some introductions and get right into the conversation about what in the world are digital therapeutics and how is Click Therapeutics changing how that's looking for the rest of us?
Yeah, no, thanks for inviting me, and it's great speaking with you, Kevin. I enjoy a call to nerd out at any time for anything. I enjoy nerding out on anything science, anything creative work. But going back to the professional life, I mean, I've been at Click Therapeutics for the past 5 years. I'm a director of corporate strategy here at Click. Prior to doing corporate strategy, I was leading our market access team as well as new product planning work. But before I came to the industry, I went to kind of take an educational background I went to pharmacy school, and going through pharmacy school, doing retail, hospital, realized pharmacy might not be my calling. So I ended up getting additional internships, going into management consulting, and actually left school to actually go into strategy consulting, advising pharma companies on how to commercialize their products. Mostly, advising on pharma market access team, corporate C-levels team on how to bring products on the market, how to be competitive, doing corporate strategy, M&A strategy, things like that. So after spending many years in consulting, I actually left consulting to join Click about 5 years ago, and then here we are. In short, I mean, Click Therapeutics is a digital therapy, prescription digital therapeutics company. We think ourselves as a digital biotech, really creating software-based treatments. So these are software apps. We're a mobile-first company. These apps are actually prescribed by a doctor, actually clinically validated, goes through FDA regulation, and it's actually with an intent to treat. I know digital therapeutics have a broader scope where we actually help manage and prevent, but our scope, which is more of a prescription digital therapeutic side, I think we're very much focused on using software to treat a variety of disease conditions.
Oh, fantastic, buddy. You really skimmed over a lot of the good, juicy parts, which is fantastic, but I'll bring them back anyway for Jaron. One of them is this: what did you not feel like you could get through the pharmacy tract? Because funny enough, you're talking to an audience right now with the American Society of Consultant Pharmacists that a lot of us have felt like, the traditional pharmacy pathway did not fit. And here's it really did, like these kinds of elements of consulting. So really diverse kind of utilization of the degree. What didn't fit in that kind of degree pathway you were initially presented, that going into the strategy and the consulting space for pharma was just hitting your calling a little more deeply?
I think the very first thing was when I was exploring what I was going to do, how I was going to utilize my skill set. I was interning at KPMG in their healthcare advisory team, and then really got exposed to the fast-paced nature of consulting, being able to kind of just absorb a lot of different type of information and kind of just structure them and communicate them. I think we're really, at the end of the day, I think all of us are problem solvers in many ways, but I think really taking problem solving and communication into another level of like structuring problems, I think that's really kind of what made my mind tick. So I think I see myself, I have market access, kind of commercial background in life sciences, but at the end of the day, core end of the day, I think I'm a problem solver at heart. And then what I do best is structure and categorize complex problems into simple, logical, steps to actually figure out what needs to be solved. How do you prioritize it? How do you resource it? How do you plan for it? So I think that type of strategy work has always been intriguing for me. I think it's also, I think that type of thinking can be applied for both personal life as well as these type of professional situations. So this problem solving skill set was kind of what I've kind of developed in the past decade.
Oh, I love that. So the one thing, I guess, for just a brief intro onto what in the world is this digital therapeutic space, specifically with Click Therapeutics, you're looking at the biotherapeutic elements or kind of overlapping the treatment aspects of how do you make something a software that really impacts human biology and nature of how we're treating disease. What is that, buddy? And when it comes to ultimate problems, like you couldn't have picked a better one, bud. Like there's so many overlapping barriers that you have to be able to bridge between FDA clearances, collaborations between clinicians, collaborations between industry, logistics, the financial barriers. And so the audience knows this. Click Therapeutics wasn't the only digital therapeutics company that was out there. They're maybe one of the only original ones that has survived. There's a number of them that have folded up shop that looked very successful. Even, correct me if I'm wrong, Stephen, who went through IPO. They were groups that were really looking like they were going to be the next innovation in healthcare that maybe no one had heard of. They were just on the cusp, and then finances didn't go in the right direction, primarily because there wasn't an avenue for them to say, I've created this new drug, this new software. How can I get paid for it? And that opportunity wasn't there. It was just another wall. So tell us a little bit more, Stephen, about maybe a little background on digital therapeutics and kind of where they're at today when it comes to the offerings that pharmacists may come across.
Yeah, I mean, I like to bring up again. As a general problem solver, I like to draw my inspiration from a lot of different industry. I think there was an industrial designer called Raymond Loewy. He was very famous for like designing the Streamliner, the Coca-Cola bottle, and whatnot. He always brought up this idea of Maya principle, most advanced yet acceptable, most advanced yet acceptable. And I think he was talking about how if you want to create something that's everlasting, we want to bridge that adoption chasm, you need your product and services to have this Maya principle. So for me, I felt like living through the past 5 years of digital therapeutics, in the industry side, some of the products I think maybe are too novel, too advanced for for folks to accept. You're going to use mobile software to do what? I think that was a novel idea for doctors, payers, patients to grasp. I think there were a lot of capital spent to kind of do that educational foundational learning. I think they did a great job in laying the foundation, studying these conversations set aside. So if you go to any conference now, AMCP, any of these, SEMBI, any of these conferences, digital therapeutics is now a common language. I think everyone started talking about digital therapeutics. So these are all foundational work that, Per, Achille, Mahana, they've kind of set up. So we're very grateful for that. However, I think digital therapeutics, especially prescription digital therapeutics, kind of face a lot of challenges in many areas, from evidence, prescribing behavior, payer, market access, distribution, security, privacy. There's a lot of new problems that we need to solve. And every time their time is against them. They're burning capital solving these problems. I think it was just uphill for them to climb. This is just to take a step back. I think just a little bit of our history on digital therapeutics. I think digital therapeutics probably came around, later in the 2010s, but really saw a huge surge in 2020, right, with COVID. I think a lot of capital came in because they really saw the opportunity to scale in-person therapy or any of these tools and trackers that you have through mobile applications. I think that opportunity was there. The framework was there. All right, let's go do it. And obviously around 2021, 22-ish, these products, digital therapeutics, are paid as wellness benefits sold to employers or direct to consumer. And around 2020, 2021, there are a few folks that are like, you know what, we are not wellness benefit. We actually are a treatment. We should be paid for such as a treatment. So we're going to branch off. We're going to call ourselves prescription digital therapeutics because these requires high rigor of clinical rigor. It needs to be prescribed by physicians. So we want to continue pursue a route of getting reimbursed as a drug. So Per, Achille, Mahana, there are a few of us folks, Click included. We're prescription digital therapeutics. That also included folks like Applied VR, Luminopia, who are VR headsets. They're like, pay us. We need to be paid as durable medical equipment, DME. Per, Achille, us, we went through as we get paid as a drug through pharmacy benefit or medical benefit. So we branched off, and then all the conversation on what I just mentioned happened about distribution challenges, evidence challenges. So yeah, it's been a really interesting journey. I think for now, we've been very, very excited because of this new guidance that just came out through FDA called prescription drug use related software. It's a draft guidance that FDA took a release on September 2018. This was a draft guidance, basically, at the edge of Pear kind of going bankrupt at around 2018. 2018. Wait, I'm getting my dates wrong. But around there, I think that's where the FDA basically said, "Hey, drug and software, there's definitely value in creating using these together. So we're going to actually clarify how drugs can be put into software and update the drug label." And as you all know, as we as pharmacists, I say we as in like spiritually connected as we as pharmacists, folks, we drug label, FDA required labeling is the single source of truth for everything, right? And being able to have software included in the drug label, I think is kind of a mind-blowing, game-changing thing that I think everyone should really be looking into, because with that guidance being out, I think we're very quite bullish that in the future there will be more products as what we're calling software enhanced drugs. So these are going to be drug and software being tied together for a treatment of diseases.
Interesting. So I got familiar with digital therapeutics about 7 years ago. My daughter has ADHD, and we enrolled her in something that was called neurofeedback, and I'm assuming that's something that's part of this, because she would sit down in front of a computer and she would do this pattern stuff, and the problem is we just couldn't get her to focus on that. And she hated every minute of it, so it was very difficult. But the Beastie Boys once said that, I'm going to cut out the part of your brain that does the complaining. And so is that kind of one of the aspects we're looking at here? Like, is this a way to kind of go in and manipulate memories and kind of change and I remember listening to a couple things where you talked about rewiring neural circuits and whatnot. So kind of touch on how that works, because the way I viewed it initially was, well, this is going to be more currently focused on subjective measures. So kind of like a placebo effect, but maybe taking it to another level. But like we're able to identify a behavioral change, so a subjective measure. However, the more digging I did, I saw one digital therapeutic that was for hypertension and for diabetes, type 1 or type 2, which I found very surprising. So kind of give us some data that shows us how we're rewiring these neural networks, and how is this going to actually make an impact on actual physiological measurements?
No, great question. I think that's the type of questions that a lot of us face in the digital therapeutics world, because I think this idea of how can software make these physiological changes has always been a question. I mean, I usually like to point at like three different types of examples. One is like if you look at our product with Otsuka Pharmaceutical Rejoin, I think there's a lot of data out there on how we showed structure like fMRI changes on how the brain function actually works based on the brain exercise that we have included in the product called EFMT, Emotional Face Memory Task. By following the process of the guided treatment of the program, you can actually see the different brain functions working, upregulation and downregulation of these functional functions. In pharmacy world, I think we always think through body systems. We always think through up and down regulation of neurotransmitters. But I think in the neurological sense, I think circuitry and overactivation of amygdala and underactivation of frontal cortex. I think these are the type of language that we start using in the digital therapeutics world. So that's kind of the first example, which is kind of like, what kind of faulty neurocircuits are there? How can we actually use brain exercises to kind of rewire them is one. Two is like software, we understand drug alone can never, in most cases, drug alone is not really enough in treating patients as a whole, right? I mean, obviously software is not going to be killing cancer cells, especially if you stick it on oncology. Drugs are going to do well. Drugs are going to do what they do best in kind of stopping the proliferation of cells, cancer cells. But I think we as innovators should hold ourselves to a higher standard and say we want to eliminate, drugs work, but it comes with side effects. It comes with pain, anxiety, fatigue. We should not take those collateral damages as like, oh, just because it is, right? So for us, we take ourselves to a higher standard and say, all right, drug works. Okay, the drug can do whatever they do, but we will help the patient to do anything else that the drug can't do. Oh, you have pain, drug-related fatigue, we'll help you address that. You have anxiety, depression, feeling lonely, we will help you address that with software. And that's why the whole concept around software-enhanced drugs is what we're thinking. Like the drug, we're not trying to replace drug. We're not trying to we're just trying to make the drug do what it do best and let software do what is best and kind of combine that together. So that's the second example. The third example I give is like really, digging into this drug enhancement aspect. So if you look at like GLP-1s, right? GLP-1s are currently, if you look at all the competitors, they're fighting over who can have how much percent weight loss, right? And you're looking at weight loss percentages. There's still lean muscle mass loss. There's still GI issues. There's also a lot of these dose titration complexity. I think while the drug is working on the weight loss, we can have diet, exercise program. These are all, and then dosing titration. I mean, I remember back in pharmacy school, you're talking about age, gender, liver, kidney function. These are all differences, personal differences that could impact how you process and metabolize drugs and whatnot. Mm-hmm. Right now, there's almost a trial and error of like, oh, everyone start with this dose because that's a guideline, and then let's go up and down, adjust. Come in a week, let's see how it goes. You report back, and we are going to go through these expensive drugs to get you to the right dose. What if we can use big data, claims data? We can use our actual data that we've kind of gathered from all the other participants that we've actually, patients that we've gathered from our trial data, and really predict as close as we can what the right dose is going to be in the first get-go, just from the data that we have. And these are the type of ways that technology can be used to help, enhance the drug, as I can say. So those are the three of use cases where a software-enhanced drug could really come in handy. And I think all three of these aspects are areas where I think a lot of pharmacists can come really use their expertise into, right? I think we talk about what does pharmacokinetics look like for digital treatment? What does dosing look like for digital treatments? What is increasing the dose, decreasing the dose look like in digital treatment? What does represcription look like in digital treatments? Is it the same thing, not the same thing? I think there are a lot of pharmacotherapeutic related topics that needs to be applied to. And for folks who are very interested in being the first one to solve these issues, this is your calling to come join a digital therapeutics company to come solve these issues,
Awesome. Yeah. So I love that you brought up side effects, because obviously we're minimizing and eliminating in some cases those side effects. And that's a phenomenal way to practice medicine. And people who practice medicine, in fact, people who do politics or politicians, I think we all agree that we live in an imperfect world. And no matter what we do, there's always, and in this case, maybe we don't call them side effects, but we can always rely on the fact that there's going to be unintended consequences, right? And so what kind of unintended consequences have you seen so far?
On regarding
digital therapeutics, yeah. And it may be nothing yet. I mean, it's just a matter of
I don't think nothing just yet. I mean, for me, I'm seeing more of the unintended side effects of like digital usage in general. Like, I mean, for me, where my head goes is like, TikTok, Instagram, social media has just really, really decreases people's attention span, increases anxiety, depression. Why can we not use that type of idea, harness that technology for the better of the patients? If we can use it to actually harm the patient, the same circuitry is happening internally. We just need to harness that for the better for the patient. So that's what a lot of our scientists in-house think about.
Okay, that's brilliant, because I mean, we're mixing two different arenas that have a delicate balance to them, like healthcare. You can turn it into volume-based or quality-based. And then, like you said, you can use technology to engage people, but also have this downside of anxiety and depression and poor attention span. And so by mixing them together, maybe they kind of balance each other out so that they both improve and enhance each other. you know?
Exactly. I mean, you talked about your example with the ADHD, digital treatment being, tedious and not engaging enough. The
Yep.
problem is the problem has already been solved in the gaming industry. The problem is already solved in the social media industry on how
Yeah.
to make digital experiences engaging. We just
Yeah.
need to use that in the healthcare space and make being healthy fun.
Yeah. That's
Make
great. Thank
being
you.
healthy fun. That's a fantastic line right there, buddy. So I'm
Yeah.
looking at the product page right now, Jaron, and I know you and I've checked out everything in Click before, but running it down for the audience, like there are a number of like product pipeline components that we would see in a pharmaceutical deck. Surprise, surprise, with somebody like Steven's background, they would have a pharmaceutical like breakdown and deck for progression of their products. But one is, at the very top is for depression, type 2 diabetes, migraine, schizophrenia, obesity, oncology, insomnia. Like it's a very broad range of utilizations of digital therapeutics. When I think most of us think, and to connect the dots, some CPT codes, some billing codes were written that were related to cognitive behavioral therapy or CBT, right? That to be done through a digital manner and we could monitor that. And very common for most clinicians to be at least familiar with prescribing CBT to their individual patients for depression. Like, here's another opportunity for us to use what is often done in a psychology type of setting or a counseling type of setting to leverage this particular mechanism to retrain the brain on how it's thinking. Give us some comparison there, Stephen, when it comes to atopic dermatitis, something that's out there. In all honesty, like when we're doing a pharmacology breakdown, depression makes a lot of sense to me, right? Because I can connect the dots with CBT. So does insomnia, that we can go through some different sleep regression trainings and all the other components to sleep awareness and et cetera. Obesity, maybe some habit training, et cetera, when it comes to meal preparations, lifestyle. But atopic dermatitis, like there's one for me. It's like, how does that solve the equation? And why am I asking this question? It's really this. If we're thinking there's pharmacists out there that are in this consulting space trying to do the best for their patients, a lot of the pharmacists in this space, we hate drugs for the most part. So if we can eliminate medications and deprescribe, we're all about it. One thing that I think is helpful that you've talked about is complementary utilization, where you add a pharmaceutical agent and a digital therapeutic agent for enhancement. But the other one that I'd like to really dive into a little bit with you is, where's the replacement aspect there? Instead of putting on a topical, when it comes to utilizing something for one of these like atopic dermatitis, how can we leverage a digital therapeutic and how does that work, for the individual patients? Like give us a little more detailing on, I'm a pharmacist at the counter and thinking I would love to find a click therapeutic product to give one of my patients or to connect my patient with in one way, shape, or form instead of prescribing this drug. How do I do it?
That's a great question. So Click had, for us, we pursue both prescription digital therapeutics as well as software enhanced drugs. So software enhanced drugs are what we were talking about before, which was the combination product of drug and a software specifically meant to work together to create a therapeutic effect. The products that we are also focused on is what we call standalone prescription digital therapeutics. So it can and be adjunctive to medication, but it is the way the studies are run, the way it's done, the way the trials are done. I think it's mostly more about to be used as standalone, regardless of whatever medication you want. And for us, the way we think about it is like we should really start considering digital step therapy. And we always go in pharmacy school, we always talk about, quality of life improvement, behavioral change. These are the kind of first thing we need to start looking at. Why, if those doesn't work, why don't we just add a digital step therapy first and let that be the first thing that people go through, even before they go through generics? Like before we go medication, it's, I know payers, they were concerned about the overall healthcare costs, but from the patient side, once you commit to a drug, then you kind of just, you're on the drug. It's kind of hard to get off. You may be mentally be also labeled as, oh, I'm now having to take drug for this. Like that mental shift of, your identification as who you are. I mean, we are very we're very empathetic with patients. We never call them, oh, diabetic patients. We're not. Your condition should not identify you as a person. You're a patient with diabetes, right? Like I think for us, we really, if you think about the digital step therapy, maybe that is one additional hurdle for folks to, stop them before they feel themselves so committed to this. And for us, I think we'd be doing injustice if we can provide actual evidence, clinically, statistically significant evidence that this product actually works with or without drugs, that person should be considered to take this drug, should be considered to take this digital therapeutics first. And then I think those are the opportunities where I think things like our CT132, which was in their studies run with adjunctive to any medication, even just Tylenol and whatnot. You can take a look into our studies. But we've actually just kind of shown a lot of our use case and actual clinical outcomes of monthly migraine day reduction coming out of that. So I definitely agree. I do think that with quality of life and changes and behavioral changes, I think we should really consider digital as a step therapy before. But going back to your initial question around being able to do mental connection fast with anything that's neurological, I do agree as well in the sense where the whole my example with like software not being able to kill cancer cells, but we can treat disease kind of behavioral component. I think for digital, the opportunity is that anything that's for us at Click, we believe that anything, if there's a neurological underlying neurological behavioral component, our scientists have kind of thought about how to address that. And then that again, if you think about it, it kind of spans quite a lot of therapeutic areas that has underlying neurological and behavioral component that can help better improve their health outcomes. Just either just by changing certain type of behavior, just by being more engaged in their treatment, just being more or working with their care team more. I think what I found out day one when I joined Click, getting to this digital therapeutic world was I looked into smoking cessation. All right. We had a product nicotine earlier in the days. Once the patient leaves the four walls of the physician's office, they're kind of on their own. Physician would be like, hey, hey, Bill, you should go stop smoking. Here are your brochures, pamphlets, and good luck. I'll see you in, your annual checkup or whatever it may be. And then the patients are now left alone. And I think what patients are still with is what patients still have is their phone in their pocket. I think digital therapeutics, the biggest value proposition is that we can reach the patient to help them and give them support that they need when they feel alone, right? I think that's the biggest, and then how can we do that? And then that becomes more of a creative challenge for a lot of digital therapeutics companies to figure out how to best serve the need of the patient when you have access like that.
So Jared and I are working on a patient right now, and this patient has episodic migraine. And look on Click Therapeutics, we're looking at CT132 that already has FDA authorization to be able to help with episodic migraine. How do we get that patient on CT132 or any of the other digital therapeutics that is offered through Click or any other digital therapeutic entity?
Yeah, so our product Rejoin with Otsuka Pharmaceutical currently is commercially available now. For CT132, we are getting it to be commercially available. We're in the steps of making sure that we can reach to patients for that. I think we do encourage folks to reach out to us directly to see if they want to continue to be in our clinical trials or if they want to try our products. But right now, our CT132 product is currently not commercially available in use for commercial use.
So the one that is then is the Rejoin, is that right?
Yes. Yes. That's that's a product that's currently commercially available now.
So rewind the script, Jaron. You and I are looking at a depressed patient together, and we want to put them on a digital therapeutic, and we want to put them on Rejoin. How do we do it?
I think you can collect. I believe Rejoin. If you go to their website, I believe there is a way you can get connected to the list of providers that that will help you address your condition and decide if Rejoin is an appropriate treatment for you. And then what happens with these prescription digital therapeutics is that once the prescriber assesses your conditions and realize that this is something that may be beneficial for you, they prescribe it for you, you download it through an app store. Without the prescriber prescription, you cannot get access to the product, even though you download it. That's why it's called prescription digital therapeutics. So once the prescriber prescribes it, you can enter an access code, and then that allows you a limited time access to a program, just like a pill. Just like you take a quantity limit, 30, 60, 90 days, your digital therapeutics is a very specified treatment program that you have access to. And for a lot of our other products, I think we're also, considering all these like maintenance mode version of where there's like a door where the intensive treatment is covered by prescription, and there might be steady state mode or whatnot you can do. So there's a lot of creative ways we can continue to provide patients access and value throughout the journey. But a lot of these are being solved as we speak. We have a very dedicated team that's working with Zuka on the next steps for these programs.
Oh, great. So a lot of them, it sounds like, then are in kind of trial and or beta phases, that the logistics of how does it go from provider to patient maybe haven't been fully fleshed out yet for all of the individual products, but others there's some direct connection with going to the Rejoin website, filling out the checklist, getting that to your provider, and then there's a mechanism. I know Jared and I are big time process guys, and I know you are too. So right now, tell us where the breaks are when it comes to, we want this Rejoin product to go to Mrs. Jones, right?
Mm-hmm.
If we want that to go to Mrs. Jones, and Jared and I have a collaborative practice agreement, we can prescribe it right now, be able to send that over. How does the prescriber prescribe it, in the first place? Because if we were prescribing a pill, guess what? We go into our EHR, we enter in the medication that we want to take, we choose the pharmacy that's going to dispense it, we hit enter, it goes through a few different pathways that enters the pharmacy's workflow, they pull it from their wholesaler, they get it to Mrs. Jones, right? That's the process. How does it work for Rejoin today, Stephen? And then where are the breaks that can be better in the future?
Yeah, I mean, so for the way with the Zuka Pharmaceutical works, I think we were helping them develop the product, go through clinically validated and regulated, and then go through FDA regulation for them. The type of commercial process and patient experiences, I have to give a lot of credit to the Zuka Pharmaceutical teams because they handle the commercial process and how this experience should be. And I've actually, to be fair and honest, I haven't been too close to the program to see how far they've come, because for the team that's currently working on it, it changes quite fast. Especially, we've kind of taken on a little bit of the tech culture of moving quite fast and changing things. If you go talk to them month by month, they've just made drastic improvement month by month. So I don't want to give information today that has maybe like a couple of versions prior that they've already thought through and made already improvements. But I will say that traditional prescription digital therapeutics that's what a lot of the issues that Pear, Achille, Mahana then face, because because again, I worked in market access. In the end of the day, market access all comes down to like coding, coverage, and payment, right? So coding, like what kind of codes are there? Is it a unique UDI code? Is it what kind of DME codes there are? Is how is it actually going to be covered? What kind of benefit? What pharmacy benefit? What medical benefit? And who's actually get paid how much? Facility fees, physician fees, all the CPT codes you're talking about. And for us, while the PDT has that type of experience and those reimbursement questions that the teams are currently solving for the software enhanced drugs, when we were looking into this combination products, we're very much bullish on this future, just because I like to call it as like, it allows us to make breakthroughs without breaking through, right? It uses existing regulatory and reimbursement pathways, because drug plus software is considered a combination product. So it goes through a combination regulatory pathway, plus it gets reimbursed as a drug. So a drug reimbursement exists. You get a new NDC code that is software and drug in a new NDC code. You prescribe a pill. In that pill bottle, you're gonna have a QR code that gives you access to the software, and it gets the drug actually get reimbursement through either pharmacy benefit or medical benefit, regardless, depending on what kind of drug it is, and goes through a regular P&T committee. So, and then when you're talking about this prescriber experience, you can literally just go through an EHR, just select as a drop-down menu of whichever medication that you would pick, and it would just come out as a new SE formulation. Instead of IR, XR formulation, you have now a software-enhanced formulation for your drugs.
I like the future kind of flow in there. Jared, any questions on those models or any other pieces on that, buddy?
Yeah, I was going to add on with a question about availability and payments. However, before that, just yes or no side tangent. Are any of the current benefits able to be measured? Like, have we noticed any measurable differences, like under an MRI? Yes or no?
Yes. So I think if you go through our studies for our rejoin, you'll see that we've kind of demonstrated fMRI changes pre and post.
Wow. Okay. That is amazing. Okay. So another thing, I was looking at one of your pages earlier, and it was talking about how early in the game you guys had difficulty getting payers on board. And one of the ways you went around that was by going directly to employers. And as a small business owner, I found that fascinating. So how is it that you approached small business owners or just employers in general on and how this should be made available to their employees?
Yeah, so for us, Click, we don't pursue the digital therapeutics route of selling to employers. However, there are a lot of digital therapeutics companies who've made a full business models out of selling to employers. It's a different business model. It exists. You can sell to employers. You sell to either large employers or you sell to employer benefit consultants. You knock door to door to employers. And a lot of these folks are mostly, the decision makers are usually from like your people team, who's kind of deciding your benefits for the folks. And these business models are usually like PM, like per member per month, per user per month, type of engagements where they kind of pay a flat fee, or some of them goes into the milestone payments. But the business model is there, and then usually they just provide it as a wellness benefit. So, at Click, we provide One Medical as a service, as a benefit, and just as a benefit, like you get Peloton or whatever gym membership that you do, just like that, you get access to the treatment, and then you get you're able to access it through your employer. So it's a very interesting business model. I can nerd out about this type of corporate business model structure as well, but that's another topic.
Agreed. Yeah. So, speaking of nerding out, we'll kind of switch gears to kind of like wrap it up here, but let's look more towards the future. Out of curiosity, the most pressing question about the future is what technology is going to come first? Are we going to have the intersect technology from the TV show Chuck in digital therapeutics, or are we going to have Tony Stark's eyeglasses as part of digital therapeutics?
Going back to the idea of Maya principle, I think that it is the more realistic thing is something that is not too advanced yet acceptable. I think especially healthcare is, we have a lot of folks who are very cautious by nature. I think we are dealing with human lives. We cannot afford errors. We cannot go break things fast like a traditional tech world does. So because any medication error that we make is actually going to cost lives. So I think for us, there may be more adoption. There may be adoption of more reasonable, more closer to what is currently available. So that's why I feel I keep bringing up the software enhanced drugs. So I feel like that checks the criteria of what is close to what people are already used to. Other stuff I think are mostly going to be, focused with either direct to consumer type of work or like employer platform type of work where there may be a little bit more lax on accepting new technology. I think it really comes down to regulation. Are you going to be a regulated product or not? If you are a regulated product, I think folks may be a little bit more cautious. However, that said, my last closing comment and thought would be like, I am quite bullish about AI in healthcare and then how AI will permeate quite fast, quite soon. And then I think there is going to be a lot of conversation and discussion around regulation of AI in the space. And when it's appropriate, when it's not appropriate, people may try and push boundaries. And then I think subject matter experts need to keep folks in check of like what should be the right thing to do for the patients.
Absolutely.
Yeah, I think the conversation is just it's an interesting one for kind of the future of healthcare because chronic disease is hitting us so brutally kind of across the healthcare spectrum when it comes to what's the bandwidth of clinicians, what's the utilization of current therapies and the expense of those therapies. How do we advance kind of at-home care? And I know that digital therapeutics is going to be a massive part of that. We have to find a way to be able to empower patients to do things, to be able to help their own disease state manifestations from from gaining traction, and then also avoiding in preventative services that I think digital therapeutics will continue to kind of advance even further. How do we bring those types of services home so individuals don't recognize that, hey, this diabetes, this pre-diabetes becomes diabetes for me? So there's a ton of benefit there, Stephen. The only thing that I want you to give one last plug on before we let you go and wrap up the show is, so one thing from work with a previous guest that they are working on model cards in the AI space with Dr. Brian Anderson and the Chai Group. I'm really excited to see that Click Therapeutics is doing something. If you go into their product section and you click on a product, it brings up what the launch was, who the collaborators are, what their phase stage is, their data behind it and publications, just all of that that goes behind it, Stephen, to really make this a fully vetted service. Give one last shout out to kind of that and what individual clinicians should be looking out for when it comes to just the slew of information that can come their way that might not be as vetted, and why Click Therapeutics is a good example of doing it the right way.
Yeah, no, thanks for that opportunity. I think, obviously with tech and tech entering healthcare with digital therapeutics, I think there's definitely a clash of culture of this idea of breaking fast, developing something novel and new. I think we forget that we are treating, there's some folks that forget that we're treating patients. And I think for us, at Click, we've held clinical rigor to the highest standard since day one here. I think that's why I think we always try to pursue irrefutable evidence of this is not statistically significant or well-powered, or our endpoints are digital endpoints. Like, we go for drug endpoints, we go for statistical significance that people can actually use and talk about. So we've kind of put clinical rigor, regulatory standards to the highest level, and I think that we will continue to do that and do right by patients moving forward. Continue to do that moving forward. I do urge and motivate and encourage folks to get more interested in the space. I think a lot of exciting things are happening. I think from the AI space to software enhanced drugs, I think we definitely need more and more passionate folks entering the space, sharing their ideas, sharing their thoughts on what the future of the world should be, because I think we're only as good as what the world that we built in. So I encourage a lot of folks to kind of share their time, energy, and thoughts on solving these problems. And if you're some type of folks that would love to be the first one to be solving these issues, this is the industry to be.
Amazing. Thank you, Stephen, for joining us, buddy.
Yeah. And, as a pharmacist that just loves getting rid of medications and has a team of equally passionate pharmacists who are also just as big on getting rid of unnecessary meds, we're excited to see what kind of results we can bring into the healthcare industry with this as a future component. And also, I'm excited to see what kind of impact this can have on dementia residents. As somebody who works routinely in nursing homes, I think there's something there that could provide a huge benefit. And I don't, just yes or no, is there anything coming down the pipeline that's looking at that?
Not currently in our pipeline, but I know our scientists have thought through mental impairment, cognitive function decline. So in that sense, I think we've definitely looked at it. But Jaron, I'm welcome you to help have more chats with us, share ideas, what we can do, what we should be doing. We're always looking for new ideas. So,
all right. Well, we really appreciate you coming. We're thrilled to explore this as a part of the future, and we look forward to future chats for sure. Thanks for joining us today.
Of course. Thank you for having me.
Yeah.
Thanks, both.